I'm the Chief Program Officer here at Horizon Treatment Services, and I'm really excited to speak about the importance of continuity of care and also recognize the pressure that is relieved overall in the system of care when treatment is prioritized early on and proactively mapped out and made available for clients when they are ready to start their recovery journey. Before I go into the details in regards to the continuity related to pretty severe presentations, such as individuals impacted and need sobering stations and facilities, facilities, residential level of care. I also want to just acknowledge the dollars that are saved in the healthcare system when we are able to intervene proactively early on in clients' symptoms that might give away potential cause for worry in developing more chronic conditions. And so, what I can reference is that in 2024, EMSA actually released some data that showed the cost saved. In the system when prevention and early intervention services were made available to individuals. And this is simply in relationship to tobacco prevention programs. The data that was shown was that $20 per individual were saved for every $1 invested. And from that data, they were also able to show that about 176,000 youth in America were positively impacted and prevented from developing tobacco use related conditions. And so when we think about both the macro and micro impact in our system of care, as well as the impact we have on individual clients, it's very significant to recognize that investing in programs that adequately affect and equip our clients do ultimately have a trickle effect. It's really important to keep that in mind when we are approaching conversations related to healthcare and treatment, because we have to acknowledge that some of the biggest barriers in treatment is the fact that it is fragmented. And what that means is sometimes an individual might have the opportunity to get in the door for residential level of care, but they may not have the opportunity to go to the next level of care that they so need in order to stay on track. And so when the system is not able to provide easy access and realistic access to the individual, then it's very, very easy for that person to become susceptible for relapse or even developed a worse condition than what they started off with. And that is simply the reality, regardless of their level of journey, whether the individual is going from a sobering facility to detox or detox to residential level of care, making sure that they have the opportunity to go through the entire continuity of care in a way that is really fitting for their needs. It's not pushed, it's not at a timeline that they are not able to integrate into their specific needs is really important. And we do see that outcomes, successful outcomes, very much depend on the individual's ability to have that journey. And so we do want to uplift that individuals who have the opportunity to speak to their case managers when they're in residential level of care as they're thinking about their next phase of life in recovery, that they have the time and resource availability so that when they successfully graduate from the residential level of care, they're really ready and they're looking forward to the next chapter and being committed to their journey at a lower level. And that is really what we want. We want the individuals to thrive and succeed and not need the intensive level of support that they were receiving when they first started. We do not want to reinforce a dependency on the system to individuals. And essentially, that is possible when the individual is able to engage in treatment at an appropriate timeline. And part of that appropriate timeline has everything to do with how easy they are able to access the next level of care. And when that is not available, and when the system is fragmented, but the individual has to leave treatment early on, and they don't have the safe landing space for the next phase, then it's more likely that they do relapse and they will show up at the same door that they started off with. And that's really a big, big challenge in the healthcare system. It's painful to see, frankly, as a provider, and it's really unfortunate for the individuals who have to go through that. And so, as healthcare practitioners, it is really our responsibility to be intentional, to be mindful, to be informed when we are making changes and are able to create opportunities so that everyone is able to go through their recovery journey in a way that ensures continuity and success and independence, as opposed to otherwise. And I think we all have that responsibility as thought leaders in the field who see the individuals going through the system firsthand. We all have that responsibility to make informed decisions because that is really what our clients deserve. And having the opportunity to see their journey in person, up close, makes a big difference, I think, when it comes to creating programs, designing policies, advocating for ways that ensure ultimately ethical practice as well as successful programs for our clients.